Drug repurposing has literally changed my life in every way. I mean, first off, I wouldn't be here if it weren't for drug repurposing. I was a healthy third-year medical student until I became a critically ill third-year medical student, and eventually saved my life by finding an existing drug that I could repurpose to save my life. It's now been over 9 years that I've been in remission, 9 years that I just never would have had if not for a repurposed drug, and 9 years where I've been able to look for more repurposed drugs for more patients. So it has both literally given me my life, but it also has given me this incredible purpose to try to go on a mission to say how many more drugs could be used in new ways to save more lives. CDRC is filling a huge gap. As you know, right now, there are 3,000 drugs that are FDA approved, and there are 9,000 diseases that don't have a single approved therapy. CDRC is being that coordinator between patient groups, researchers, the federal government, advocacy organizations, industry, to be able to move forward to actually make sure that drugs that could be useful for a horrible disease are actually used for that horrible disease. CDRC is the ultimate connector. In fact, Collaboratory is the word that's used as part of the name. And I think Collaboratory is the right word to use. It's about collaboration, bringing the right people together, but it's really the laboratory part too. It's testing things out. It's trying to figure out what's the best way to do it. And there's just amazing leadership at CDRC between Marco and then of course Heather's role from the FDA. This is just, it's the right team doing the right mission to serve this huge problem. I think what's really exciting in the repurposing space is that there are a number of new organizations that are interested in helping to push things forward. CDRC, Cures Within Reach, Every Cure, and there are others. And what's really exciting is that each of us is taking a little bit of a different angle for addressing this repurposing problem, and we're able to work together along the way. And so we ended up choosing the name Every Cure and Every in it to try to indicate that we want to work with everybody. And CDRC really has that in its core as well. And so specifically with Every Cure and CDRC, we already have a partnership in place where Every Cure is utilizing our data analytic platform to identify promising drugs for a sepsis trial, which CDRC is facilitating, organizing, coordinating, and then will actually run the trial. And so a really cool opportunity where it's sort of bringing our data analytics to bear to pick out the right drugs, bringing CDRC's expertise with coordination and collaboration to bear to actually move the trial forward. So that's hopefully just the first of, I think, many collaborations we're gonna have together. So the Castleman Disease Collaborative Network is an organization I started back in 2012, and so a little bit over 10 years old. And really the mission of this CDCN has been to first better understand what's going on in Castleman disease, and then to look for existing drugs that can be repurposed to treat it. And so really from day one, we've been focused on trying to find drugs we could repurpose, and we've been really successful. In fact, we've identified 11 different drugs that can be repurposed for Castleman disease and that are saving patients' lives all over the world. And so for me, it's just been so amazing to obviously find a drug that could help me and give me a life and a family and a real life's mission, but also to be able to see all the other patients that are benefiting from these drugs, thanks to the CDCN's just relentless focus on, we don't want to just do research that might result in something 10, 20, 30, 40 years down the road. We want to do research today that's crowdsourced from our community, what's important to them, and then we want to look for solutions tomorrow so that patients can benefit in a week's time. And that's the kind of turnaround time that we as patients deserve, we demand, we need, and it's organizations like CDRC that are facilitating that sort of progress.